Hello everyone. Today we are going to start a new chapter in community health nursing. Before starting this topic, I think everyone experienced that if you are having a fever, you'll go to doctor and he'll ask many questions to you, like when you got the fever, how you got, what you ate, and what treatment, any treatment did you took, or and he'll check your body also by using stethoscope or by using thermometer, or he'll touch your body, something he'll do for this procedure. What you'll call, for this procedure we'll call it as assessment. Today we are going to learn regarding health assessment. This is unit 3, health assessment. Okay, today we'll see what is health assessment. Health assessment is essential for any planning. After planning we'll do implementation, after implementation we'll do evaluation, and we'll take decision related to that evaluation, what we took the evaluation in community service. This health assessment is a regular and continuous process. This is an important tool to determine the health status of an individual, community, or national. It is not only for a group of people, it is for individual also, or for community, or it may be for national. Next we'll see advantages of health assessment. Direct interaction of community health nurse with the people belonging to different age groups of community. Means directly we are speaking, directly we are meeting it with the community people, and we are gathering the information from the patient and or from the group, and we are interacting with each other as a nurse. And next, early diagnosis of disease or disorder. Before getting the disease, we are trying to identify the disease by assessing the patient in community. And next, appropriate opportunity for providing health education and protection against disease. Before getting disease, we are giving health educations. I think all of you know regarding this health education. You'll give personal hygiene or environmental hygiene, like this. Many health educations you are already gave in the community posting. So like this health educations also will give to uh, to give protection against diseases. And next, knowledge of health status of community, to know the status of community. uh, and next we'll see discovering the health problems and getting information to prepare the plan. Means we are identifying the problem and we are planning what to do for that particular disease or particular problem, or to eradicate or to get saved from that disease. And last point, opportunity for the community health nurse to develop good relations with the community. Means it is a good opportunity for a nurse to maintain a very good relationship or to interact with the community people. Next, we'll see components of health assessment. There are two main components of health assessment. One is taking history and another one is physical examination. I think this while collecting history only, yeah, at the same time you'll do physical examination. This taking history is so essential to gain faith of the patient and to interact with the patient and to feel to make patient to feel comfortable, and you'll collect all the information regarding the patient, and you'll ask what is his family socioeconomic background and nutrition, previous disease, accidents and present illness, like this many questions you'll ask in this taking history. We'll see like three types, like complete history, inventory history and problem focused history. Here in complete history, we are collecting history at the first time meeting. When patient come to hospital, nurse and patient jointly assess the health problems through it and take steps to solve it. In first attempts only, you are identifying some problem and planning to solve that problem. This is complete history. And inventory history means here complete history is collected in more than one session or one meetings. Means more than one meeting they are collecting history, means that is inventory history. Complete history means that the first visit only they are identifying problem, means that is complete history. In inventory history means more than one time meeting they are identifying problem or collecting history, means that is inventory history. And problem focused history means this type of history is useful for getting information about problems and needs rising after the last meetings. Actually it needs based history, means here after meeting what the patient will feel discomfort, what patient needs, that problem again you are discussing, is that is problem focused history. And then next we'll see structure of history. Here, firstly, we'll see personal and social history, like what is their name, age, everything, and social history also. What is their nationality, everything we'll ask. In family history, we'll ask any hereditary diseases or family tree also we'll see. Family composition, everything we'll see. Past medical history, as you all know, if anything happened in the past, we are collecting that history and what happened, what treatment he got, and now he's cured or not, everything he'll ask. And present history, now what is the difficult for him. And chief complaint, when he is coming and approaching, or when he got the disease at that moment, what he felt, what he is suffering from, that will tell us chief complaints. And next we'll see physical examination. In physical examination, there are 4 steps, as you know: inspection, palpation, percussion, and auscultation. You know already, inspection means by observing, by seeing, you're doing the examination. Palpation means by touching the patient, what you are feeling, any abnormalities, like any extra mass, any accumulation of the fluid, those things. And percussion means by tapping, you're observing. And auscultation means by using instruments like stethoscope or fetoscope. That method will call as auscultation. And some of the following points should be included in physical examination for health assessment: measuring weight and height, taking temperature, pulse, respiration, blood pressure, and pulse oximetry, PPR, and examining patient physical and mental development, and observing patient figure, shape, color, and look of individual. And lastly, we'll see head to toe examination. This is conducting physical examination and taking history for health assessment. Already I told both of these activities can be performed at the same time. Next, this place of health assessment where we should collect the history or where we should do the physical examination. First one is individual's home. In that particular patient's home only, or health center like PHC, CHC, or any clinic. And last one is hospital. In the hospital, it is important to details of the of health assessment should be recorded appropriately, and patients should be assessed by the nurse. If she's uh, for a minor thing, she'll give the treatments, or if it is emergency, she can refer that patient to the higher hospitals. Characteristics of a healthy individual. Characteristics of healthy individual. It is difficult to describe the universally acceptable characteristics of a healthy individual, because no one is so perfect. No one is having so perfect system which exists and can be used as a standard for these characteristics. Everyone is having their own different systems. Next, we'll see characteristics of a healthy person can be discussed under following headings. First, physical characteristics. It is a major part of an individual's health, and most of them can be measured by head to toe assessment. Firstly, we'll see general appearance, like healthy appearance, their weight, height. It is there according to their standards, or their intelligence, their pleasant smile, their their facial expressions, their friendly natures, they are properly dressed up or not, they comb their hairs properly or not, their good posture, everything we'll see. Next, we'll see mental status of the patient. We'll observe he is oriented, what we are telling, he can able to understand, and he is oriented to time, place, a person, or we'll observe what is the answer he is giving for our questions, and he is maintaining his eye contact to with contact to us, or he is good in judgment. All his capacities, what is his capabilities, we'll see in this mental status. Then we'll observe speech, how he is talking, his speech is in clear, appropriate, it is correct selection of the words during speech, or whatever the commands we are giving to him, he is giving right answer or not, and he is getting correct word for that particular sentence. Everything will observe. Next, head and neck. um, in head and neck we'll see range of motion of the head. And next we'll see hair, it is cleaned or it is shining, oiled or combed without a dandruff, everything in its scratches, everything will see. In hair we'll see up to dandruff. The scalp and the skull will see how it is smooth or not, it is firm, it is symmetrical with no information, or any cyst, any lesions or tenderness, any scratches, everything will observe here. And next, face. How is his face? His face is shining, or no abnormal marks over the face, or any abnormal movements in the face. These things will observe. Neck will observe it is symmetrical with smooth controlled movement, or it is without scar or without lesions, on trachea in middle, lymph nodes not palpable, everything will observe. Next we'll see eyes symmetrically arranged, eyelashes, eyebrows, everything we'll see, and any discharges, and uh, the pupil is reacting to light, everything we'll see. Next we'll see ears. Ears are normal in size or not, it is arranged symmetrically, without any lymph nodes, any discharges there will see, or any deformities there, we can able to hear the sound equally to the both ears. Everything will observe. Next, nose and the color of the same. This no means the patient nose and the face color, it should be same, it is there or not we'll see, and any lesions, any discharges, any nasal septum midline, everything will observe. Is any abnormalities will mention. And next, if you're going to mouth, firstly we'll observe lips, it is symmetrical or not, it is smooth or not, moist or no nodules or lesions, any cracks we'll observe. Next, buccal mucosa, pink and moist without discoloration, no ulcer. Next, we'll see gums, it is in pink and moist without erythema and cyanosis or any bleeding and inflammation which they will observe. And teeth, if that person is having 28 to 32 shiny white in good condition without any dental caries or hygiene of the teeth, everything will observe. And next, tongue and palate, middle, symmetrical, moist, pink, and with smooth movement without nodule, etc. Both palate in normal conditions. And next, we'll observe taste, how we can able to taste the food, and the chest symmetrical or even and relaxed, sternum and ribs without any deformity, respiration regular like 16 to 20 um, breaths per minute, is this taking breath or not, normal, any wheezing, all these things will observe. Next, heart rate like 70 to 76 beats per minute, it should be, it is regular or not, we'll see. And heart sound, uh, that will observe. And next, breast, it is symmetrical arranged or not, no, we should that should be no tender, no lump or lesions, it should not have any discharge, lymph nodes not palpable, everything will observe. Next, abdomen, here it is round or it is soft, symmetrical, any bowel sounds audible and normal, everything. And girth below the chest circumferences, abdominal girth below the chest circumference, everything will see. Then upper extremities, arms symmetrical or types of motions, movements, tensions or bony deformities, everything will observe. And muscles, reflexes are normal or not, these things will observe. In lower extremities, legs are symmetrical or not, any lesions is there or not, uh, bony deformities without any rashes, any edema, inflammation, and will observe range of motion. After this, sensory system will see normal sensation is there or not, will observe. Later, systems review like respiratory, cardiovascular, gastrointestinal, musculoskeletal, endocrine, um, neurological, including psychological system, should be free from any deviation, dysfunctions, or problems. Next, we'll see social characteristics. Have a good means the person should have a good relationship with the community, with the society, and he should be in a positive with what society is taking the decision, and he should participate positively. We should have a good interactions, uh, and he should follow the social changes or any socialization process and social control, and he should be active socially for overall well-being of the society. If anybody is taking good decision to improve the society, we should be active in that. Next, spiritual and cultural characteristics. A healthy individual should have a holistic approach He should believe his own religion, but he should respect other religions also. He should not uh, blame, or he should not judge other religions, and he should follow the ethics and principles of the community, what they are maintaining and what the commitment they're having with the uh, com- higher god, higher being or god. And he should also respect the cultural values of self and society, as well as should give respect to others cultural norms and values. How he is giving respect to his culture, and he should same wise he should give respect to others culture also. And spiritual and cultural characteristics play important role in health. Next, we'll see mental characteristics. Firstly, self evaluation. The person should be aware of his own limits, uh, and he should know how to overcome from his own problems. He should able to accurately estimate his potential. And next, adjusting capacity. The person where he is living, he should be able to adjust, and it may be for pain, sorrow, and for joy. Everything he should be adjustable. Whatever the situation he may facing, he should be adjust to that particular situation. And next, maturity. This maturity, uh, mentally, what he is behaving and what he is having, that emotional controls, that will call as maturity. uh, and how he is behaving, his manner, how he is expressing his feelings, thoughts clearly, that we'll see. And his sexual behavior is also mature. Next, non-extremists. Excess of everything is bad. Even it is good thing also, if it is excess, it is bad only. If you are taking in a mental characteristic, uh, any deviation from the normal, it is abnormal only. So it may be good behavior, it may be good thoughts, or it may be exercises, it may be eating something or speaking more. Everything, it affect the mental status of the person, and it should be avoided for the development of mental health. Next, regular life. uh, every person is having his own habits in his own regular life, like eating, sleeping, walking, loving one another, or giving support to one another, and behaving like mature manner, and he wants to live without any problems naturally. What everyday process he's doing, that we can see in this regular life. Next, good social relationship. A mentally healthy person maintains good social relationship with the people of society, colleagues, and family members. And he know how to respect and how to take the responsibility, and how to develop his own personality, everything he know, and he is ready to balance the relationship. It is helpful to develop his mental health status. Next, job satisfaction. Where he is working and what he is doing, he should be satisfied with that work, and he should feel happy, and he should have that good environment, working environment surrounding him. Next, lastly, other characteristics, like the person should not do not daydream, or expert in social activities, or conscious about physical health. Pay attention to make balance in every aspect of life, work and behavior. They take responsibility of their actions, and he should know everything in his life. And he should know how to maintain his physical work and mental work. This is regarding mental characteristics.